Now let's talk about credentialing. Once you graduate from the program, you need to earn your credential from the National Board for Respiratory Care. There are two credentials that can be earned. First is the CRT, or Certified Respiratory Therapist. You have to graduate from a COARC accredited program, which we are a accredited program, and you take the MBRC Therapist Multiple Choice Exam, or what we call the TMC exam. And you meet the minimum cut score. If you get less than the minimum cut score, you have failed the exam. If you get over the minimum cut score, you are a CRT. Now the other credential is an RRT, Registered Respiratory Therapist. Again, you have graduated from an accredited program and you have passed the high cut score on the TMC. So there are two cut scores, a low and a high. Passing the high cut score will make you a registered respiratory therapist. So it's one exam. There are 165 questions. 140 of them are graded and 15 are pre-test questions. 25 of them are pre-test questions. They test your knowledge and your critical thinking skills. And the exam is 4 hours long. So when should you take your credentialing exam? Well, you should take it within 1 month after graduation. We strongly suggest this because there are two facts that won't change. The longer you wait to take the exam, the less your chance of passing the exam. You're going to start to forget things. And the examination only gets harder. It never gets easier. You have up to 5 years to take the exam. But if you waited 5 years to take the exam, what are you really going to remember from respiratory school? Now, the exam is written off of what's called the exam matrix. The exam matrix are the things that tell us what they're going to be looking for, what you're going to be tested on. So each examination that the MBRC offers has an exam matrix. I include the matrix on the back of your syllabus every semester. So the general RRT exam matrix is on your syllabi. However, in the critical care course, Respiratory 210, the ACCS matrix is there. Now, we will be making changes to the program, and when that goes into effect, it will also have the neonatal pediatric matrix there. Right now, the Respiratory 230, which is the PFT, has the RPFT matrix, and Respiratory 270 has the neonatal pediatric specialist matrix. So, if you want to know why we're teaching you whatever it is that we're teaching you, or if somebody comes up to you and says, I don't know why they're teaching you that because you don't need to know it, look at the exam matrix, because I'll bet it's in there. Now, we've talked about the AARC, the MBRC, and COARC, but the PSRC, the Pennsylvania Society for Respiratory Care, this is your state organization. When you are a member of the AARC, which is required to be in the respiratory program at HAC, you are automatically a member of the Pennsylvania Society for Respiratory Care. And you can go to their website, psrc.net, and it brings up the website. And you can look at all of the different things that are available. And we strongly encourage you to be active in your profession. The PSRC is divided up into 3 educational districts. The East District, the Central District, which is what we are a part of, and the West District. Now, a long time ago, there used to be 7 districts, but getting volunteers can be a problem. So they divided it into 3 districts, and they divided it so there were an equal number of therapists in each district. Now, as a respiratory therapist, you must practice under the direction of a medical director. So you cannot just go out and do things on your own. You must be under supervision of a physician. So in your hospital, when you're working in a respiratory department, your department has a medical director that oversees policies and procedures. We also have a medical director here at HAC for our respiratory therapy program. So when you are doing clinical, you are practicing under our medical director. Our medical director's name is Dr. Santoth John. You may or may not get to meet him. Sometimes his schedule is busy. But it is a COARC requirement that we have a medical director. The last organization I want to touch on is the Joint Commission on Accreditation of Healthcare Organizations, or what we call JACO, or the Commission. Now, Joint Commission is an independent, not-for-profit organization, and it sets the standards by which healthcare quality is measured in America and around the world. Years ago, being accredited by the Joint Commission was a prestigious accolade for a hospital. Now, if they accept federal money, they must be accredited by the Joint Commission. So these people set the standards, just like we have COARC setting standards for us and how we do things in our program. Joint Commission sets the standards for the hospitals and how things work. You will learn more than you ever wanted to know about the Joint Commission when you are working in healthcare. And sometimes we do the things that we do because that's how Joint Commission wants them. The last aspect I want to touch on is licensure. In Pennsylvania, we are licensed. So you get a license just like a nurse does. You will apply for a license. You must renew your license. And you must have continuing educations to maintain your license. You also have to have continuing education to maintain your credential from the NBRC. We talk more about this as we get into the later semesters when it's time for you to start applying for a license. Not every state has a license. Some have a legal credential, which is not the same as a license. Currently, 49 states in the country have some form of licensure or legal credentialing. The only state that does not is Alaska. One thing about having our licensure is we have title protection. You cannot call yourself a respiratory therapist unless you have gone through a respiratory program, a COARC accredited program, and you have taken the NBRC boards. Then you can call yourself a respiratory therapist. This helps to protect the public so that they know the person that is taking care of them, that says, I am your respiratory therapist, has the training and the knowledge to do what is necessary. In Pennsylvania, our license is issued by one of two agencies. Either the Pennsylvania Board of Medicine or the Pennsylvania Board of Osteopathic Medicine. So our licensing board is the same as physicians. We do have respiratory therapist representation on the board, but they set the guidelines. Most of you will be licensed through the Board of Medicine. And as I said, we talk a lot about that once we start getting towards the end of the program. In the next video, we're going to talk about triage and disaster management.